Hi guys, my name is Dr. Lee Sung. Welcome to my YouTube channel. Have you ever wondered if beets might actually help your erections? It sounds like one of those internet claims that gets repeated so often that people start to wonder if there's some truth behind it. Well, there actually is a real scientific reason. This idea exists because inside your body there is a very important molecule called nitric oxide. And nitric oxide plays a key role in how erections happen. Think of it like a signal or a trigger. When sexual arousal begins, your nerves and blood vessels release nitric oxide, and that signal tells the smooth muscles in the penis to relax. Then the blood vessels open up, blood flows in more easily, and gets trapped inside. And that's what creates firmness and an erection. So in simple terms, nitric oxide is like the ignition system that starts everything. Without enough of it, the process doesn't work as smoothly. Now, this is where beets come into the story. Beets, along with foods like leafy greens, arugula, and spinach, contain something called dietary nitrates. And your body can convert those nitrates into nitric oxide. So in theory, more nitrate-rich foods could support higher nitric oxide levels. And that could support better blood flow overall, which is why people started linking beets with sexual performance in the first place. But here is where we need to stay realistic. Most of the research we have is not directly measuring erections. It is mostly looking at blood pressure, circulation, and exercise performance. So while the biological pathway makes sense, the direct evidence for stronger erections from eating beets alone is still limited. Some studies suggest that to meaningfully increase nitric oxide, you would need a consistent intake of nitrate-rich whole foods, not just occasionally. And even then, the effect on sexual performance can vary a lot from person to person. So does that mean beets are useless? No, not at all. If you enjoy them, they are actually a very healthy food choice. They support blood vessel health, they contain antioxidants, and they can improve overall circulation. And since erections are heavily dependent on blood flow, anything that supports vascular health can indirectly support erectile function over time. But they are not a quick fix, and they are not a treatment for erectile dysfunction on their own, because sexual function is influenced by many different factors. Sleep, stress, hormone levels, medication side effects, mental health, cardiovascular health, all of these play a role. So focusing on one food alone and expecting dramatic results is usually not realistic. Now there are also other nutrients that have been studied in this area. For example, L-citrulline and L-arginine. These are amino acids involved in nitric oxide production pathways. Some small studies suggest they may help improve blood flow in certain individuals, but again, the results are modest and not guaranteed. So when you step back and look at everything together, beets are best thought of as a supportive food, not a treatment, not a cure, but a small piece of a much larger picture of vascular health. Now moving to another important topic, vaginal estrogen. A lot of people hear the word estrogen and immediately think about risks like cancer or blood clots, so it is completely understandable that there is concern around it. But vaginal estrogen works very differently from systemic hormone therapy. It is mainly used when estrogen levels are low, especially after menopause or sometimes during breastfeeding. When estrogen drops, the tissues of the vagina and vulva can become thin, dry, and more fragile. This can lead to discomfort, pain during sex, and sometimes recurring urinary infections. Vaginal estrogen helps restore those tissues locally, improving moisture, elasticity, and overall comfort. The important point is that it works mostly in the local area. Only a very small amount is absorbed into the bloodstream. So systemic hormone levels remain very low. Because of that, the overall risk profile is very different from oral hormone therapy. Large clinical experience has not shown a significant increase in serious risks like blood clots or cancers when used appropriately. Most of its effects stays right where it is needed, in the vaginal tissue itself. Some people may notice mild changes when they first start using it, but these often settle over time as the body adjusts. Overall, it is considered a very safe and effective option for treating vaginal dryness and related symptoms. Now finally, let's talk about delayed ejaculation. This is when it takes a very long time to reach orgasm, or sometimes it does not happen at all during sexual activity. And for many people, this can be frustrating, confusing, and emotionally stressful. It can happen for different reasons. Sometimes it is related to age, where nerve sensitivity naturally decreases over time. Other times it is linked to learned sexual patterns. especially when masturbation habits involve very specific types of stimulation that are hard to replicate with a partner. Over time, the body and brain can become conditioned to respond only to that specific pattern. So anything different may not feel strong enough to trigger orgasm easily. In those cases, treatment often focuses on retraining those patterns. That can include changing stimulation habits, introducing variation, or working with a partner to rebuild different types of arousal responses. Sometimes even taking a break from very specific routines can help reset sensitivity over time. In more persistent cases, there are medication options that may be considered, but it is important to understand there is no single approved medication specifically for delayed ejaculation. So most approaches are off-label and based on limited evidence. Some medications act on brain pathways involved in desire and reward and may help improve sexual responsiveness in certain individuals. Others may influence hormonal systems involved in sexual response cycles, but results are highly variable and not everyone responds the same way, which is why treatment is often personalized and may involve a combination of behavioral changes and medical support when appropriate. Devices and stimulation tools may also be explored in some cases, although research is still evolving in this area. So overall, there is no one-size-fits-all solution. It often requires time, patience, and a step-by-step approach to understand what is actually driving the issue. And when you look at everything together, whether it is nitric oxide in diet, hormone therapies, or sexual function concerns, one thing becomes very clear. Sexual health is deeply connected to overall health. Blood flow, hormones, nerves, lifestyle, and even learned behaviors all interact together. So instead of searching for a single miracle solution, the most effective approach is usually improving the system as a whole, gradually and consistently. To wrap this up, your body is responsive, adaptable, and capable of improvement when given the right conditions and support over time. If you found this helpful, consider exploring more topics like this to better understand how your body works. And if you want more clear, evidence-based breakdowns on sexual health and wellness, make sure to follow along, because the more you understand your body, the better choices you can make for it.